Welcome back to Plan ORE. This is the second part of the introductory video of DTP, which is one of the components of the ORE Part 2 examination. In the Part 1, we have discussed about the general features of DTP and the first two blue sheets, whereas in Part 2, we'll be discussing the green, orange sheets and the presentation part. So stay tuned for Part 2 of DTP. If you like us, give us a like, subscribe to us, or contact us through any of the following, and come join us at Plan ORE. So after you have finished your blue sheets and the 10 minutes timer goes up, at this point of time, the examiner and the patient both leave the room and you're given some clinical findings. These clinical findings comprise of pictures, casts, or some written things like the BP scores or the non-carious tooth surface loss scores and so on. You need to go through them properly, combine them with the history you've taken, and arrive to a proper diagnosis. Once you arrive to a diagnosis, you need to list them on this orange sheet over here, which is the first orange sheet. And here on the subsequent column, you need to write the reasons, which comprise of the history you've taken or the clinical features which you have seen and which have actually led to your diagnosis. So you may have about 1, 2, or 3 diagnoses depending upon the number of chief complaints. But apart from that, you will have some incidental findings. For example, your clinical findings may say that the patient has caries in 4-6, but the patient did not complain about it. But you still need to mention this in your diagnosis, and the reason you need to write that as seen during the clinical examination. It is very important that you include the incidental findings in the diagnosis as well. So this is how those findings will look like. You will have pictures of the case, some written things like the teeth present, that the non-carious tooth surface loss is present, the BPE scores, and so on. Make sure that you go through each of them properly before you arrive to a diagnosis. This is a second orange sheet where you need to write the x-rays or the radiographs that you are gonna prescribe to this patient. Always remember that you do not expose the patient extra. That means that you don't take more x-rays than actually required, because it is really important that you follow the guidelines, and it is also important that you also justify what x-ray you're gonna take. So remember what all diagnoses you had written, and depending upon those diagnoses you mention the x-rays or the radiographs. The incidental findings x-rays are not really required because the patient hasn't complained about it. However, if you think that this incidental finding is something very dangerous and it requires an x-ray at this point of time, you can mention it and give a proper justification for the same. However, make sure, and on a safer side, try not to give any x-rays for incidental findings if they're quite minor. Once you have finished the second orange sheet, you come to the third orange sheet where you need to list investigations. These are certain tests like the indices or the vitality percussion palpation test or the examination and so on. So for every diagnosis, there is a particular 2 or 3 investigations, and the more you practice, you remember them, and it becomes easier for you to write them down just looking at your diagnosis. At the same time, you need to give a justification as to why you are giving that particular investigation. It is okay to write many investigations and it really doesn't matter. However, in radiographs, make sure that you list only a few of them. So these are the 3 orange sheets which you need to finish in a time period of 11 minutes. Also make sure that if you have left anything in your blue sheets at this point of time, you go back and finish it. For example, the patient's name and address, you can go back and finish it by looking in these subsequent sheets because here it would be written or printed. Once the 11 minutes are over, the sister will step in and she will take away your orange sheets from you at this point of time. So remember that now you cannot make any changes in the orange sheets. She will give you some more findings and an x-ray. And now your 23 minutes timer begins. So the first green sheet is the interpretation of the x-ray, and if you remember, there was a picture of an x-ray given to you in the main room for interpretation. You again have the same picture in this green sheet as well as a real radiograph of the same. Make sure that while you're interpreting the radiograph, you actually look at the radiograph and not the picture because the picture is very blurred. So you look at the x-ray and write whatever has been asked. This is in no way relevant to the patient, so it does not affect your treatment plan. After you finish the first green sheet, you have a second green sheet. Now as I told you, the nurse gives you some more findings and these are your final findings. So you need to take them in your account when you are writing the treatment plan. There is a small chance that your provisional diagnosis may be wrong. After you see the final findings, you say, oh, I feel I have written the provisional diagnosis wrong. Don't worry and don't panic at this point of time. Just move on, consider the final findings and now give a proper treatment plan so at least your treatment plan is correct. Now there are 4 phases in which you need to divide your treatment plan. The first phase is the immediate or the emergency phase where you need to mention what will you do to relieve the patient's pain or discomfort. The second is the initial or the stabilization phase where you will treat all the diagnoses which you had listed in your orange sheet. At the same time, you will tell the patient all the options he has. So giving you an example, if the patient has apical periodontitis and he is in pain, in the emergency phase you will give local anesthesia, open up the tooth, debride the pulp and give a temporary dressing and advise some painkillers to relieve his pain. In the stabilization phase, you will give him options that either he can get a root canal treatment done and save the tooth, or he can remove the tooth and get a replacement done. The third phase is the preferred definitive, where you will write what is best for the patient on what you think. So if I think root canal is a better treatment, I would write that in the preferred definitive. And finally is the maintenance phase, where you would mention the 3 R's, that is the recall, review and reinforce. The recall is the time period like 3 months or 6 months depending upon the risk the patient is at. Review is all the treatment you have done, you will review it. Like you will review the root canal treatment, the oral hygiene status, the smoking status and so on. And the reinforce is you will reinforce the oral hygiene advice or the denture hygiene advice. The patient may also be smoking or may have stress or may be drinking alcohol. So you need to offer help regarding the same or offer him advice to quit smoking or change his alcohol type or reduce his alcohol and so on. All those things will also be listed under the stabilization phase. This is the third green sheet where now you need to justify your treatment plan. So the first question talks about that what are the advantages of your treatment plan? Now probably you have two main diagnoses depending upon the two chief complaints of the patient. So you have two preferred definitive treatments. For example, you have RCT for the apical periodontitis and you have scaling for his gingivitis. So you will divide your question into two parts. Write the advantages of the first preferred definitive year and the advantages of the second preferred definitive year. The second question talks about the disadvantages and you will list them again. The disadvantages of root canal and the disadvantages of scaling. The third question is whether you would do the treatment and if yes, what part and why. So you will write that yes, I will be doing the root canal treatment and the scaling as it is within the scope of GTP. However, if you're not going to do the treatment and every treatment is going to be referred to a specialist, you would fill this column. So you would either fill the yes column or the no column depending upon your case. The fourth question is, would you refer to the specialist? If yes, which specialist and why? So for example, if you're referring to an implantologist, you will say, I will refer the patient to an implantologist for the placement of an implant with so and so tooth because it is not within the scope of GTP or it is in the complexity index 3. Every specialist or every treatment which you refer will have a different reason. However, if you're not going to refer, you will fill the next column. So again, you will fill either the top part or the bottom one. You then come to the fourth green sheet, which again is a blank page, and utilize this for writing your medical link. For example, the patient told you that he has asthma in the medical history. You will write that you will update the medical history of the patient. You will offer stress-free dental appointments and make sure that he does not have stress at any point of time. And if there is anything, you would ask him and try to calm him down. And specific handling. For example, now the patient has asthma. So you will tell the patient to get his salbutamol inhaler the next time he comes to the dental clinic if he is using one. So every medical emergency will have a specific handling. And we will be covering separate medical emergencies in separate videos. So this brings an end to your green sheet, which you need to complete in 23 minutes. And with practice, you can finish this in about 20 or 21 minutes and utilize the last 2 or 3 minutes to write your presentation points. It is very important that you list your presentation points so that when the patient comes in, you can just have a look at them and start speaking without fumbling through all the pages. So at the end of 23 minutes, the examiner and the patient enter the room and the 10-minute timer starts. Greet them and start by talking about the medical link. So for example, the patient has asthma, you will tell him that you would, if there is anything that stresses him regarding the dental appointment, he can let you know, as well as he needs to bring his salbutamol inhaler in the next appointment. Then you go ahead with the diagnosis. So for example, the patient has 4 diagnoses. Every diagnosis needs to be mentioned in a perfect order. So for the first one, you will tell him what your diagnosis is, what is the reason, what will you do in the emergency phase, and what options does he have later on with all the advantages and disadvantages of each option. You would then go to the second diagnosis. For example, you say that you have apical periodontitis in it, and you would explain to him what apical periodontitis is because this is a jargon. So when you're using a dental term, make sure you explain it to the patient. You would tell him how it happened. What will you do in the emergency phase? Like you will debride the pulp, give him medications, give him a temporary dressing. And the options are root canal, advantages, disadvantages, extraction, advantages, disadvantages. Make sure that you stop at every point of time and ask him if he's understanding what you're saying and if he has any questions. So try and make it like a conversation and don't keep lecturing whatever you have in your mind because of the exam stress. The best way is to look into the eyes and talk because that shows confidence. If the patient asks you, what do you think is better? Is RCT better or extraction better? At this point of time, you will tell him what you think is best and why. And then once everything is over, you would thank the patient, give and return all the sheets to the examiner or the nurse, or just keep it on the table and move out of the room. So that's how a DTP exam is conducted. And you are marked on the 5 components. So you at least need to pass in 3 components to make an overall pass. However, the best thing is to keep practicing and practicing so many times that you pass in all the 5 components. So thank you for listening. And there are a lot of more videos on YouTube regarding the ORE Part 2 examination. Please have a look at them and contact us through any of the following if you want to join us, or if you have any more questions, do let us know. Come join us at Plan ORE. Thank you.